gotta be nice before 8 o'clock in the night.
Yeah.
This is what a daytime committee looks like.
Yeah. I mean, I'd like to go with mine.
I got you.
Give me some hair. You did that. No, it's okay. That's
It's like a meat locker in here. We need some more hot air. Can I pass these out? Thank you.
where'd Amber go? Secret?
She's passing out the couch.
Make it real Are you just like intermittently spreading it? Is there a few? Is that what you're doing? Like we're sharing? Okay. Okay.
You question my intern work here?
You can?
Whatever you want me to do.
Okay. Yeah, whatever.
Oh, we can cut you off. Yeah.
Okay. Hi, everybody. Amber, come on, let's get this thing rolling.
Just to be clear, we're not doing this one.
Which one?
1993, we're not, it was still in the packet.
Okay, and hey. Okay, I believe it or not, we lowered our quorum, and so it's only 8 now, so we can start halfway on time. And Senator Strickland, we'll just go ahead and put you first. And that would be for Senate Bill 456. This is the Central Caregiver Registry.
Thank you, Madam Chair, members of the committee. It's that time of year. I'm supposed to be in 3 places at once. Let's see. Representative Lott hasn't changed since I served with her. Always, never mind. Going back to Senate Bill 456, make sure I'm presenting the right bill. I'll get 3 bills at one time. This that time of year. This bill goes back and amends our 2018 law that created a caregiver registry in our state. And this is where long-term care facilities utilize this registry where fingerprint-based background checks are done looking at workers in those facilities. And we did this bill back in 2018. We also allow private individuals to use the same registry if you're caring for someone that's elderly. At the time, there was a request to expand this to more people, such as those caring for disabled adults, and we did not feel, from the department standpoint, didn't feel we were quite ready to make it that expansive yet. Now, the department came back to me this year, DCH, and brought the idea of actually expanding this to those that are also caring for disabled people. And so someone in our state that's caring not just for elderly people, but also someone that's disabled could utilize this background check, this caregiver registry, to check out those that they're working with people in their households. In addition to that, one other change we made in the Senate to the bill was including those that are they're arranging care for Medicaid members through structured family caregiving. That's also, as you see, in lines 36 and 37 as well. And so that's it, Madam Chair, a good bill to make sure that we are utilizing all the resources at the state to help those in our state that are spending their lives caring for their people that need them in their life every single day to care for them. And you look at people especially that need respite care, that are also working individuals that have to put someone in their care in the hands of somebody else. This gives them a chance to know more about who they're putting their loved ones in care of. So happy to answer any questions.
There we go. Okay, Representative Hilton.
Thank you, Madam Chair. Thank you, Chair, for bringing this great bill. I had a very productive conversation with the young man over there in regards to the actual registry itself and how it works. Is this a registry in the traditional sense of the term, in that there is a list of approved workers that have gone through, gotten background checks, fingerprint? Can you walk me just through the mechanics of how this registry looks and
I'm
works?
going to defer to someone from
Sure.
DCH. I know we did the bill originally in 2018. It was my first year in the Senate. It was, if I remember right, maybe it was when Governor Deal was. It was 2018. It was a bill for a governor deal for the administration, and we were told then it was a way to kind of get a thumbs up or thumbs down about somebody from the long-term care facility standpoint. But someone who knows more about this than me
Sure.
is here.
Hi, Joe Hood. I'm the Chief Operating Officer for the Department of Community Health. So it's not a registry in the traditional sense of how you expressed it. What would happen is if a caregiver of, say, like my mom, I need a caregiver for my mom, and I'm trying to hire someone independently to go in and provide respite care, for example, in certain hours. There wasn't a means by which to provide a background check on that person like there is in a facility. We had facility background checks that were in place previously that we gotten approved, as the chairman referenced. But for caregivers to do that, we had to set up a separate process. So it's the same process as a facility, but the individual is acting as the employer instead of the facility, and whoever they're hiring has to agree, and they assign and they consent essentially, and then they have to go and give their fingerprints to the third-party placement, just like a facility employee would. That runs through a state GCIC and FBI background check, and it also runs through all the other registry checks that we have, so sex offender, debarred individuals, and so forth, and comes back and gives our Office of Inspector General a background that they then turn to the employer that says yes or no. Yes, they're compliant with what's in statute for criminal background, or no, they are not. It doesn't give them any history, and it doesn't store any of that. There's no wrap-back function, so there's no retention of the fingerprint in this particular instance. It's just that at that point in time, you're getting a yes or no on the criminal background status of that
And
person.
if I didn't agree or consent, most likely that person wouldn't be hired. I mean, the care.
Right, it would be at their discretion. I mean, they could still hire them if they wanted to, but certainly that's the point right away. If you won't go do one, then that probably would be a factor in your hiring.
Perfect. Thank you.
Okay, Representative Taylor.
Thank you, Madam Chair. My questions were in the same vein. It's not a prerequisite for a license or anything. It's just a place for someone to check. And if I request someone to go get this registry and they refuse, then I can just say, I'm not going to hire you. Is that?
That's correct. It's not related to any licensure or anything of that nature. It's simply a criminal background check, consistent with what you would do if you were going to go be a health aide in a nursing home or assisted living or something along those nature. But it doesn't have any licensure or qualifications tied to qualifying. Just that employer is requesting you to go forward and do that.
Okay, thank you. I think it's a good bill. Thank you.
Representative Chokos.
Thank you, Madam Chair. I remember that bill, and I thought it was quite good at the time. And at the appropriate time, I would like to make the motion.
Okay, we have more questions. Representative Bennett.
Thank you, Madam Chair, and I am in support of the concept of this bill. I just am a wordsmither, and if we were to go to line 30, where we use the word incapacitated, is there a legal reason that we have to use the word incapacitated? And if not, I'd like to consider impaired, impairment, impaired.
Well, I think we have to ask our legal counsel. Impaired would be okay, all right. I'll let you offer that as an amendment.
I'd like to
Do we
offer
have
that
to
as
do
an
that
amendment.
or can we just do it as word? Okay.
Can he respond to that, make sure it's not some reason it's
Oh,
in the
okay,
code?
certainly.
I mean, I think that we have the wording that we have in there now to be consistent with disabled definitions and so forth. So I don't know if that would impact it, but I don't believe it adds to it for certainly. It certainly could put some jeopardy on us being compatible with our disabled definition. We were very careful to try and make sure that we had the exact wording of where disabled is in the other sections of the code and to be consistent.
Can we find out for sure?
Pardon?
Can we find out for sure?
Absolutely, we can
Okay.
research it.
Representative Oliver.
When I saw the word disabled, my mind immediately went to a definition. And impaired is a different entity. I mean, I can be impaired by the fact that couldn't take alcohol, or I have an allergy, or disability, I think, does have a much more precise definition of hiring a caregiver. I can be impaired by having 2 drinks of alcohol. So I think the word impaired is not as precise from my perspective.
Madam Chair,
Yes.
it does say mentally or physically. So in my profession, impairment is equal to disablement. But if there is a legal reason to have incapacitated, then I'm okay with that.
Yes, so this definition is already in code, and we're mimicking that definition here for use. So if we change that, my fear is then we're not covering that entire disabled community where this is defined elsewhere in code.
Okay, so it's okay to leave it like it is, and I'll just, okay. Representative Lott.
Thank you, Madam Chair. I was just going to add to that definition conversation, and I think that incapacitated, meaning the deprived of strength piece, fit with the way that we were looking at this legislation, and I just wanted to say I would certainly be in favor of keeping it to incapacitated.
Okay, Representative Stoner.
Thank you, Madam Chair. Specifically, I wanted to ask, because I know it's probably not in this, but as it refers to the criminal background check, obviously you're searching the Georgia GCIC, the Georgia Crime Information Center, and also, well, actually, what's the NCIC, which is through the FBI. So in the underlying act, are we charging a fee? Is the fee being charged?
Yes, sir. I think the fee is approximately $56 to undergo a fingerprint background check today.
Right.
And we don't encompass how that's accomplished in the legislation, but
Right.
but there would be a fee that someone would have to pay to accomplish that, either the employer or the one seeking.
Right. I want to make sure, so whatever, somewhere that was, because I've dealt with this issue years ago on a criminal background check issue, because at one point, local governments could not access the NCIC. And we had to correct that, plus we had to come up with a fee because GBI didn't want their budget blown through the roof.
Yes, sir.
So I just want to make sure that was obviously
Yes,
covered.
sir.
Thanks.
Okay, that's the end of the committee members with questions. Do we have anybody? Thank you, Joe. You might have to answer the questions. Anybody from the audience that wants to speak to the bill? No? Oh, sorry. So,
He's got a
thought
lot
you
of
were fixing to
testimony. I
come
was
to the
getting
front to
nervous.
speak. What are you carrying in that? Do we need to have the police
bag.
look through it? The Capitol Police? Okay, so yeah, but, she wouldn't blow up a good pocketbook like that. Okay, so there's no one that wants to speak to the bill? All right, what is the will of the committee? Oh, okay, Chokas has a do pass. Have a second?
Second.
Got a second? Is there any further discussion from the committee? Okay, everyone in favor of the passage of Senate Bill as it is, 480, say aye. Aye. Anyone opposed, say no. Okay, the ayes have it. Thank you very much.
Thank you, Madam Chair. Appreciate y'all's time.
Our rules people have something that has to be filled out and I have to sign. So
Yes, ma'am. I'll get on it.
to get on it, to get it moving. Thank you, Senator.
Appreciate y'all.
Let's see. Okay. Ms. Walker. Okay, which one's we? Okay, all right. Senate Bill 480. Who sponsored that? Mike Hodges, is the senator here?
He's not in the room.
Pardon?
He's not in the room at the moment. He's on his way.
He's on his way? Okay, all right. Well, okay, shall we then have, is there people from DBHDD that want to talk and give us a report about their workshop? Okay. Tell us who you are, and I will tell you there is a Senate bill creating another commission, and depending on how this report comes out, I think that maybe passing of that other bill might be sort of like a duplication. So before I took that up and before we talked about it, I wanted to just hear the report.
Good afternoon, Madam Chair and members of the committee. My name is Ron Wakefield, and I'm the Director of Intellectual and Developmental Disability Services for the Department of Behavioral Health and Developmental Disabilities, DBHDD for short. I've been with DBHDD for 19 years, and I have over 40 years experience in the field. Thanks for asking me to present an update on the work of the IDD work group. The Intellectual and Developmental Disabilities Work Group was convened in September of 2023 to assist in developing potential solutions in 3 areas of focus. One, the IDD planning list, new options waiver, and the comprehensive waiver. The new options waiver is a waiver that just provides for someone who needs some supports while living with, as an example, with their family. They need a few hours of support from someone to come in and help them with their daily needs. The comprehensive waiver, on the other hand, requires 24/7 supports. So it requires a lot more supports than the now waiver. And typically, someone receives that outside of their family home. So the IDD work group was charged with looking at three specific areas. That's the first one, the planning list. The second was a community hospitals and emergency room, where individuals with IDD over the past number of years were stuck in the EDs. The third option, that focus that we looked at, was the IDD provider workforce, and I'm here to provide an update on all of that. We partnered with the University of Georgia Carl Vincent Institute of Government to facilitate a work group planning process and guide the development of recommendations. And it was a very robust group, and we had a lot of recommendations. But this afternoon, I'll just focus on one in each area. There were copies passed out of the entire final report for you to take a look at your leisure. But for now, I'll just highlight only certain areas. And starting with the composition of the work group. The work group was comprised of a wide cross-section of people, including a self-advocate, advocates from the Georgia Council on Developmental Disabilities, the Georgia Advocacy Office, provider organizations, families, and there was also a member who had a family member on the planning list. We also included the case management, representation from case management, which we call support coordination, and also a legislator. So I just wanted to see the broad cross-section of who was a part of that group. So the IDD planning list. Let me start with that. The challenges that currently we place. Before I get into that, let me just say, we call it a planning list because it takes into mind not just people who need services now, but people are also going to need services in the future. So you'll hear people mention there's like over 7,000 people on the planning list, and that's accurate. But what you need to understand is it's comprised of a combination of people who need services now and people who also need services in the future. And I'll just walk us through that shortly. In the process, one of the recommendations, there were, as I said earlier, there were many recommendations, really great recommendations from the group. And I'm just going to focus on one in each area this afternoon. For this one of the recommendations is that we hire a national consultant who has had experience working with states to address the nuances and the issues and the concerns around the planning list. And we're currently, DBHDD is currently, I have the approval, I have the funding to go get such a consultant to come in and help us. And the approach that they're going to take, and they've taken this in the past, it's not just DBHDD coming up with a plan to figure out all the issues and represent everyone. What they do is they start at a grassroots level. They literally go out and meet in communities with individuals, with families, with advocates, and they develop a plan that as a IDD system, we can have agreement on in terms of how we move forward with how we consider the planning list. So that's the plan that we're pursuing as of right now. And we also are working towards, by next session, to have a plan that we can present to you with what the outcome of the work would be. And that would better aid the General Assembly in terms of making decisions around waivers, etc., just to give you an example. So I'm showing you this chart, and it basically explains how we go about now trying to determine who are the folks that are most in need, who need services right now. What you see on the slide is how the individuals currently on the planning list score on the level of unmet need. That's what's important, because we're trying to meet their unmet needs. They receive a score between 0 for the lowest level of unmet needs and 156 for the highest level of unmet needs, based off an assessment tool called the determination of needs. Once an individual is determined pre-eligible for the waiver, we check in with them on an annual basis to reassess their needs. So it's very current and it's very active. The tool is objective, but the needs score could change pretty quickly depending on the individual's circumstances. For example, a person could have many of their needs met and have a low score, but then and having a low score means that you don't need services now or anytime quickly. For example, a person could have many of their needs met and have a low score, but then their caregiver could fall ill or pass away, or they could become homeless, which would then move them to the highest level of priority. This is why we try to stay in contact with individuals on at least an annual basis and encourage them to stay in touch with us in between. The reality is that there are folks on the planning list that enter a crisis who are in need of services but cannot receive them due to the workforce shortages that we're experiencing now. And before I wrap up, I'll talk about what the work of the General Assembly has done in making some decisions that are going to be helpful with that as we go forward. And to give you another example of, say, someone who has a score of 5, what does that really mean? For instance, a 26-year-old female who lives with mother and grandmother needs assistance with finances, preparing meals, and routine health tasks. Most needs are met by her family. Another example, so that's why low score, 5. Example of someone who scores 76. 19-year-old male whose family recently moved to Georgia. Person has a diagnosis of autism spectrum disorder, developmental delays, autoimmune condition, tic condition, and congenital blindness. Not enrolled in school since arrival. Mother recently passed away. Father and sibling providing supports. Georgia Pediatric Program, which is another waiver program through the Department of Community Health. Application pending and would be primary due to his age. DBHDD assisted with links to other community resources. So there are other resources that need to be explored prior to DBHDD stepping in. About 4 people on this chart are in the category of highest unmet need. And a real-life example is this. Individuals scored 126 and entered services after this assessment. A 20-year-old male who was living at home, emotional outbursts, cursing, yelling, throwing objects, etc., assault or injury to others, hitting, kicking, scratching, biting, choking others, property destruction, breaking dishes, glasses, and cell phones, self-injury, hitting and scratching self on arm, face, and legs. So someone that scores 126 is someone that needs to get into service immediately. So that was just an explanation of what you're seeing on the chart. And the majority of people on the list do not need services now. 30% are under 21 and can receive services from other sources. Another area that the work group focused on are the number of individuals who are stuck in community hospitals. On any given day, like instance today, there's probably an average of 30 IDD diagnosed individuals that are stuck in our emergency departments across the state. Most ERs are not properly equipped to manage the needs of IDD individuals, leading to difficult ER experiences. Challenges in establishing services after discharge due to a lack of providers. The long-term goal is to maximize use of federal dollars for the IDD system. And so the next steps, the first item you'll see, 3 new community residential options to enhance provider capacity to serve individuals with IDD with very challenging behaviors. There's just limited options within the system right now, but we have a recommendation that we're pursuing. It's now pending DCH board approval and then federal approval through CMS.
Are you contracting this out to?
To what you said secondly, it will be contracted out under our waiver system, just like other homes that we have, except that these homes will have more specialized behavioral nursing services, etc. So as a short-term solution, and we're piloting 2 new homes in the Augusta area. And those homes are going to be opened this month, and currently 8 beds. But what it means is this: someone stuck in an emergency department, we'll be able to transition them very quickly to this home, to these 2 homes, and then be able to get them stabilized and then transition back to the community. The question that begs to be asked is, okay, you just said 30 on a day and you have 8 beds. We got to start somewhere. But the plan is over time is to build up that capacity. So that's our short-term goal, and then our long-term goal is also that. And the second thing that I do want to just highlight is we are currently in the process, and this is a long-term goal, of building what we consider IDD Crisis Services and Diagnostic Center in Macon. And we're doing that in conjunctions with 2 types of providers. For the diagnostic center, because one of the issues that we have now is that someone with IDD who presents challenging behaviors, there's nowhere for them to go to be appropriately diagnosed and stabilized. And this center will be able to do that. And it's not going to be long-term. People are not going there to live. The diagnostic piece will be like an outpatient type of services. The Crisis Services Center, people will be able to stay up to 90 days to get stabilized and then return back to their community. And that's with a current provider, River Edge. So that's in the process of getting built. So that's also another part of our long-term solution. And lastly, taking a look at our IDD provider workforce. My apologies, I keep hitting. There you go. Okay. Before I dive into this one, you may have heard us and probably advocates, etc., talk about the DSPs, right? The direct support professional. And what's that and who are they? the direct support professionals really are the backbone of our system. And who they are is they're the individuals that work one-on-one with individuals with IDD. So they are the ones that are on the ground trying to help support individuals with IDD. Currently, and you've probably heard this also, the hourly rate for them is $10.63. And you can see why we had a crisis in our provider network. And the challenges that are listed here, low wages and benefits for the DSPs have caused historic turnover and burnout rates, insufficient competency-based training and supervisory mentoring supports, and a lack of career ladders and or professional advancement. So in terms of the next step, what we have done is there are 3 pilot projects that are on the way now that started in February. And the main purpose of those pilot projects is to create career ladders and an incentive for DSPs to want to stay doing that job, and also an opportunity for professional advancement. We had capacity for 600 DSPs, and I just want to say to you, within a matter of weeks, 600 DSPs signed up. Now, it's a pilot project, and I'll get back and tell you why, what we're planning to do afterwards. As of today, the plan was that it started February of this year, and it was supposed to run. It is supposed to run until February, March of next year. And as of today, we already have 2 DSPs who have completed the course. The incentive is, at the end of it, each DSP will get $5,000 as a bonus. And so it's just a shot in the arm for our DSP workers. It's a pilot, but the long-term plan is this. As we renew the waivers in the next couple of years, we will learn from the pilots and also include that in our waivers. No other state has done that as yet, but that's our plan, to ensure that if they're the backbone of our system, we need to ensure that we're taking care of them, because that's just critical to all that's going on. The next thing I'd like to focus on is the IDD rate study. And I hope this is not news to anybody in this room, and I'm sure it's not. We are so thankful that the General Assembly and the governor has approved $79 million to fund our rate study. And that's going to be a game changer in terms of building back up the capacity of the IDD provider network. And it will also be able to, remember my saying the salary now for a DSP is $10.63. It's going to move the bar from $10.63 all the way to $16.70. And there are benefits built in that I'm sure will, again, be a game changer for our DSP. Also, I just want to say thank you to all those who are in the General Assembly who also approved the IDD Crisis Services and Diagnostic Center in Macon. That was approved by the General Assembly, so we're greatly appreciative of that. And the last thing, I would like to thank you, Chair Cooper, and members of the committee, for your work to end sub-minimum wage through House Bill 1125. And with that stated, I'll pause for any questions.
Okay. Representative Oliver, and if I missed you last time, I'm sorry.
Thank you, sir. I am assuming, and you'll correct me if I'm not saying what I assume to be true, that 7,000 children, 7,000 names on this list are all adults. Are they adults over 21, or are they adults over 18, or do they include children?
They do include children. In fact, 30% of the 7,000 are under 21.
And those 30% are entitled to IEP services, and that would be a priority of entitlement to those children, not in terms of if the state has money. Am I correct about that?
Well stated.
So hypothetically, if those 30% were getting the entitlement that they're entitled to under the Federal Special Ed Act, then your list would be down to 4,500.
So that's part of the work that we will do, because people will say all the time, there's 7,000 people on the planning list. Like, everybody needs to have services now, and that's not accurate. But I think it's important that as a system, we come to an understanding on both sides, the department and advocates, etc., so we can make the right reference as we move forward.
I make this reference and this distinction for the benefit of my colleagues because really what is some people have called a competition not to serve. The IEP should serve these children, and because they're not serving these children, as the children are legally entitled to, you are now in a situation of 7,000 instead of 4,500. Can I ask one more question, sir?
Yes.
I thought that the General Assembly last year went ahead and appropriated money to move the $10 to the $16, but it was it within Governor Kemp's disregards that it did not move immediately? So we're being thanked again for something we already did. And had the money is not started flowing yet, or is now flowing, yes or no?
The money is not flowing yet.
Okay, so we passed it this time last year, and it's still not here because of the disregard. Is that an accurate statement?
Yes, and there are other steps that need to take place, and Governor Kemp has approved that we can move forward with those other steps. Ultimately, it needs to get sent to CMS, the feds, for their approval. And it will be getting presented to the DCH board this week so we can move ahead with that step.
Just pointing out to my colleagues, we're doing the same thing we did a year ago, and it's kind of discouraging that we've lost a year. Thank you, sir.
Point taken. Okay. Representative Perkle. Yeah.
Thank you so much. I'm assuming from your graph, so that does include, as Representative Aller has just stated, it includes 30% of these are under 21 that would qualify for another program. So I'm assuming you have both a graph for the now and a graph for the comp, because this is a compilation here.
That's correct.
And I would assume, and perhaps wrongly, and you can correct me, that the comp needs breakdown has more people front-loaded to the higher needs scale.
That's correct.
So the question that I have regards the consultant that we talked about to pare this list down, get a closer look at what the needs are, and find effective ways that we can allocate resources to reach either the most number or the most effect. One thing that I would love for them to look at, so if I've been on this scale and waiting for 3 years, and my score might have moved up just a little bit, but I still have not received the service that I'd love to have for my family member. And someone from another state moves in and has a higher score than me and bumps me off of consideration for another year. That would be problematic for me or my family if I've been a lifelong resident of the state of Georgia and I'm waiting for these services and someone from another state comes in and, I hate to say, takes my slot, but when we're looking at a limited resource, it could be taking my spot. And I'd love for us to look at, in addition to making sure that we get bang for buck in allocation of state resources, that we meet the needs most efficiently for this class, for both classes and now in the comp. But that we also have consideration for
long-term residents of the state.
Well, I mean, I hate to put it that way, but if our services become such that, hey, I'm in, Alaska, and hey, I hear if you move to Georgia that you could get jumped to the front of the line based on your need schedule, that we're not using state resources in that way, if that makes sense. I'm assuming that's part of the overall mission for having an expert to pare down this list and find efficiencies. Is that correct?
That's absolutely correct. And the question or the comment or the statement you just made.
It was not a very good question, I'll go ahead and tell you.
No, fully understood by me, is part of what the discourse that will take place when you start talking to families and start talking to individuals. I'm absolutely sure that would come up. But those are the things that we need to have a discourse about and have an agreement in terms of how we move forward. And as we discover efficiencies or try to develop them, that's an excellent point that I think will be part of the conversation.
And Madam Chair, that just disappeared on me. So let me ask question B, and hopefully I could do this a little bit more efficiently than I did on the last one, as Jody is Representative Lott's rolling her eyes at me. Can we make sure that we are looking at efficient distribution of resources and finding ways that, so if we could become more efficient, then instead of treating 3,000 cases, we can treat 3,300 cases and impact more people using the same resources. So it's not just, hey, this is this is what this person needs, but if this person and this person in the same community could have a co-shared resource, then we provide additional bang for buck, if you would. So efficiencies in the use of resources.
Well stated, and let me give you another example. This was something members of the work group suggested, that our now waiver and our comp waiver are high dollar waivers. What about looking at the possibility of a waiver that costs a whole lot less? And then you can stretch it and serve more people. So that's also part of the conversation that will take place.
Thank you, Madam Person. Yes. Georgia has a lot of bright spots. This is not one of them, and it frustrates me because this is some of our most vulnerable population, and I appreciate what you're doing, and we're doing good work. I've seen the list grow over time. It was interesting. We have a child with disability. I was texting my wife as we were sitting here, and she says, we've got a 14-year-old, now 15-year-old son. We need to get him on the now comp list today so that he may be eligible someday, years from now. So I think that's the 30% you mentioned. 29% is probably that, parents freaking out saying we've got to get. Where my frustration is, I feel like we study this issue, study committee this issue, consultant this issue to death, and we just need to do something. As was mentioned to my right here, I do applaud the rate study. I think it does ultimately get done this year, which, it's a two-prong issue. It's that, you can approve all the waivers you want. If you don't have workers, right, there's no point, Right. Did I see correctly in the budget we don't have any new approved slots this year?
Yeah.
We have.
Yes. 100.
Okay. There's a Senate bill out there and creating a commission, which I'd be in favor of. I think a permanent solution to take action on this is a good thing. Is that duplicative? Would that get in your way? Do you have any thoughts on that?
Well, what we're doing is we're doing the work now. And this is a big part of it. And to what you're saying, it drives me crazy. But if I was in the same boat, I'll do the same thing. That a family, as soon as their baby is born and they realize the child is diagnosed with a developmental disability, there's a sense of urgency to get on the list now because you don't know how long you're going to wait.
Yeah.
That's the issue we got to deal with. We need to develop a process and a system that when people need services, they can get it as quickly as possible. And so people aren't left in the dark to think, I got to sign up now for that because I don't know what's going to happen in the future. That's part of the work. I think that's the biggest part of the work that we need to come to agreement on in terms of how we move forward. Other states have successfully done it. And so we have examples that we can also follow.
Yeah, because I'll tell you, the 2,600 families that are in need of 0 to 16, they may not have a need, to your point, now, but as parents, they stay awake every single night thinking that 16 to go to 100 real quick, and I'm not covered. Frankly, that's what keeps me up at night. And I don't, to be honest, I don't think we're doing enough about it.
Can I say one thing to that? So that's how robust a system we need to develop, that when that score hits 100, the system is ready to meet the needs. That's where we need to get to, and that's what we're working towards.
Thank you.
Thank you, Chair Cooper. My name is Darcy Robb. For those who don't know me, I'm the Executive Director of the Georgia Council on Developmental Disabilities. Thank you for the opportunity to speak to this today. I'm going to try to be brief here. I was a member of the IDD work group that Director Wakefield just spoke about. Really appreciated that opportunity. But I want to do just a quick bit of framing first because I think Representative Hilton made a very important point. Georgia has a lot of bright spots. This is true that our IDD services, particularly for adults, is not one of them. At GCDD, we put together a one-pager. We have almost enough copies for y'all. I apologize. We did not have a whole lot of heads up, so it goes this time of year. This just kind of gives an overshot of our IDD system and some of the big issues. So you're going to see on the front, we've got a graph that shows Georgia's fiscal investment compared with other states in the Southeast region. We only put in about 56% of the national average. So this is just not an area that Georgia has invested in. And that has costs. That has a lot of costs for us. On the back, you can see this graph tracks the waivers and the waiting list over time. You can see we've not really chipped away at the list. We've put in a small amount of new waivers and then a small amount of attrition, about 400 a year. So I think we are very much on the right track with this rate study. I think we're starting the momentum going in the right direction with the IDD work group. But I share this with you to see that this is a huge problem. With the waiting list, we had a couple families down here testifying a few weeks ago. One family spoke about how after waiting for 10 years, they finally have hope because their son was just granted a waiver. I'm going to tell you all, I hear this story all the time. And you might think, okay, well, 10 years, maybe nobody's homeless, nobody's in crisis, nobody's going to jail. But what about the parent who quits a job to support their child? What about the child who is stuck at home for 10 years? Nobody's going to grow. Nobody's going to, it's just so much harder to plug somebody into the community and have them live up to their potential when they have this tremendous gap. And I don't say this to blame Director Wakefield and his team. This is just the situation we're looking at now. The other family member who spoke actually had to seek a legal remedy in order to get a spot on the waiting list. So I just share these anecdotes with you because we do have to be real here. Our system we're starting to move in the right direction, but there's a lot of work yet to do. And that's why we also think that having something like a commission, having a good targeted 5 years of work, having public input, having multiple legislators involved, that's really going to be key. Greatly appreciate the work group. I think we did some good work in terms of getting folks out of hospitals. I think the DBHDD rate study for direct support providers and other services is absolutely critical. The waivers, the waiting list, sometimes called the planning list, there's more work to do on that. I believe plans are to keep working over the next year. These are huge projects, but there's a lot that the work group did not have a chance to touch on, right? And I don't say this to fault the work group. We had, I think, 6 meetings over 6 months. We didn't talk at all about transportation. Huge need, especially in rural Georgia. We didn't talk about employment. We know that everybody with a disability can work, and then they become taxpayers, and then many times their needs go down. We didn't talk about housing. We didn't talk about managed care. This is a big one for our community. How are we going to grapple with managed care? Are we going to introduce that to the waivers? We did not talk about technology. Up in Tennessee, they've got some folks with disabilities living in smart houses. This is not to fault the work group. We just didn't have capacity. We didn't have time. So I want to support the work of the work group. I think it was a really good start, but I do want to emphasize that it really was just a start, and therefore I just want y'all to keep that in your minds for framing. And as the conversations continue, and hopefully the conversation about Senate Bill 198, which would create a commission to really, in my thoughts, really kind of turbocharge and move the disability system where it needs to go, similar to the Behavioral Health Commission that's had a lot of success. Okay, that's all I've got. No, there's a lot going on. I get it.
Oh, there's meetings everywhere. Questions from the committee? No? Okay. Okay. Well, and we'll be nice to a senator, even though, very briefly, Sally.
Thank you, Madam Chairwoman and members of the committee. I am the author of Senate Bill 198. I'm thrilled that a work group met during the past year because we couldn't get Senate Bill 198 moving through the Senate. And so that meant that the work of the Senate Study Committee that started all this could continue, and that was very helpful. But a work group in a department is dependent on the leader of the department wanting that work group to be done, which our commissioner currently is really invested in this issue and wants the work done. But if there were a change in leadership, there'd be the potential that the work group would disintegrate. And in fact, the work group has finished its job, from what I understand. I, as the author of Senate Bill 198, didn't even know the work group was meeting. So it wasn't a very public process. And I think what Senate Bill 198 does is guarantees that for the next 5 years, this issue is going to be dealt with, and it's going to be dealt with the expertise that it needs, and it's going to be dealt with in a very public way. And we just took we had 5 hearings across the state when we did our study committee. And as we went from community to community, so many people showed up to talk about this issue that in many cases we had overflow rooms. They really wanted to be heard, and the issues were complex and they were different from community to community. And so Senate Bill 198 guarantees that this work will be done over the next 5 years and includes the expertise, 22 members, that is needed to bring all the groups and all the competing interests together at the same table. And so I do not see it as duplicative of the work group. I think the work group is a good start, but we need to take it to the next level. Thank you.
Okay. All right. So yeah, the committee's heard it. You know, we are going to have another meeting. Can I have, what do you want to give me, a show of hands that thinks we need it? Or, I mean, is this part of the, what, okay, okay. Is this the report of the committee? Is it? Yes. That's the report of the committee in full? Yes.
Madam Chair. Let me just say, I think we need it because we have, the benefit of being here year after year after year is that I'm sensitive to hearing the same discussion year after year after year. So I think we need it. Maybe we could skip a couple of years before we have to talk about there's 7,000 people on the list and we don't have.
If we had the, if we had it. Okay, well then, okay, we're on hold with this one, and I'll let you know, Sally. There's still time.
480.
Uh-huh.
Are you going to call 480 today?
No.
Okay.
Okay.
Thank you.
Thank you. But you know what? Thank you very much for coming. Okay. I can't get the
Author here.
I can't get the author here. So, in fact, I need to be where the author is. I thought maybe we could just switch, but we can't.
I think we're adjourning.
No, we're not. No, we're going to do the workforce one. What number is that? And the author's not here for that. The senator's not here. But, Chet, say your last name? Basine, who is in, what's your title? Come on up to the.
Thank you, Madam Chair, for allowing me to speak. I'm Chet Basine. I'm the Executive Director for the Georgia Board of Healthcare Workforce. We are the administratively attached agency to Department of Community Health. We're the agency, in brief, that administers residency payments, so that's graduate medical education to hospitals for residents, administer the operating grants to Mercer and Morehouse Schools of Medicine, and also administer service cancelable loans to physicians, dentists, nurse practitioners, and physician assistants. SB 480, which was Senator Mike Hodges' bill, and I know he apologizes for not being here, is a bill that enacts, would allow us to enact, the legislation would be enacted if should this pass, to administer service cancelable loans to those who are in the behavioral health and industry. So whether you're a psychologist, psychiatrist, counselor, therapist, this would allow us to administer. The funds are in the governor's recommendations. The governor did put in $850,000 into the budget actually last year, but since legislation wasn't passed, the governor disregarded the funds, and the funds are still in our base budget for this year. So that is the intent of the bill in front of you.
Committee, be careful where you sit. You may be called to be chair. Thank you for your presentation. Just for the committee to clarify, this is Senate Bill 480. We're looking at LC 339611, which I assume is what you have in front of you.
Yes, it is.
Awesome. With that, I've got a question to my right, number 26.
Thank you, Mr. Chairman.
Are you 27?
I'm 26. Is it, no, can you use 27, please?
Yeah, 27.
Okay. All right. Thank you, Mr. Chairman. I just did want to add that this is in the budget, and this is something that is very needed. And if we need a legislator to bring it forward for the senator, I'd be happy to do it. Motion do pass.
Thank you. I love the brevity while I'm chair. We're going to, a question to my right, Representative Oliver.
I was totally confused. When I asked the chair whether she was taking up 480, I understood that she wasn't. But here we are, you're presenting 480. Am I with it now?
You're with it.
Okay.
Yes, correct.
What is the difference of this and the student loan forgiveness program in 1013 and all the other student loan? I've been struggling trying to get the 1015 where we appropriated $10 million of loan money, forgiveness money going forward. And what's the difference? Why are we need another bill, which I think we do, but why do we need another bill?
I believe this is part of the 1013. Well, sorry, no, this wasn't part of 1013 because this is separate funds that the governor had put in his recommendation. But since we never had legislation that passed, is my understanding.
You understand my confusion? Mm-hmm. You and I have talked about this because you came about the time 1013 was passed.
It had,
and I couldn't get student finance to implement the moving forward. And so I don't want to slow this down. I want to be for anything you're for, but somebody's got, I'd like to be explained why do we need this? What's different? Does it expand or does it cut back? And is this going to work? That's, excuse me, Mr. Chair, I'm sorry to be so confusing about this.
my understanding is that the $850,000 the governor has put into our budget, if should this pass, this would allow us to then administer that specific.
They being you?
Us would be, we would
not
be.
student finance.
Correct.
Maybe
Georgia
that's
Board.
The problem.
Georgia Board of Healthcare Workforce would be then allowed to administer the $850,000 that is in the governor's recommendations.
And we appropriated $10 million last time. So somebody will explain this to me, and I won't belabor this point or keep anybody longer.
Well, maybe Representative. Perfect. We're going to go down front. excuse me, Representative Hutchinson with a question. Maybe she'll shed some light on.
No, I can't. But I'm just as confused about that. But I did want to say, as a clinician and with a staff of almost 100 that work in this field, thank you. And I don't know that people understand that even with a master's degree, when you work in behavioral health, you would be lucky to make 50 grand a year after a master's degree. So having loans forgiven, because when you graduate with those kind of student loans, you're a professional, you have a master's degree, but you can't afford rent, a car note, and student loans. So this is going to be really helpful for a lot of people, so I appreciate it. Thank you.
Thank you.
Thank you. Is anyone in the audience, besides this young man here, signed up to speak on Senate Bill 480 or House Senate Bill 40? All right, seeing none. What is the will? All right. Okay. Do I have a second? Second. Any discussion on the motion? Seeing none. All in favor of motion do pass, say aye. Aye. All opposed, say nay. All right, motion passes. Bill goes forward.